Welcome back to Get Moving TV. Our guest today is Dr. Maggie Park. Dr. Park has joined us at the Pediatric Diagnostic Center and plays the role of general pediatrician there. Our children tend to be a little sicker, but she also does a very good job with our well children. She's brought with her a number of skills above and beyond, besides her gentle smile and lovely laugh. Dr. Park, tell us, where did you train and what brought you to Ventura County?
I did my pediatric training in New York City at St. Vincent's Medical Center and Hospital. And I came back to Ventura County to be close to my family, who are all living in Southern California. Well,
that's great. But now there's several things that attracted me to bring you into the practice, and among them was, of course, your interest in obesity. What kind, are you playing any role in the state of California in terms of preventing obesity and
currently I'm serving on an expert panel with the California Medical Association, which is working hand in hand with the California Association of Healthcare Plans to develop an obesity toolkit, which will be dispersed to all providers in the state of California in the coming months.
And then I like all my pediatricians, of course, to have a special interest, and I know you brought another special interest with you. Claudia Harrison referred to it. Tell us a little bit about how you got involved in the Reach Out and Read program.
Well, Reach Out and Read is a national nonprofit organization, and as Claudia said, it's been in function since 1989. And so when I was back in residency, we had that program already in place in residency, and I was part of the committee there, starting back in New York. And since then, I've remained involved with Reach Out and Read, and was part of a Reach Out and Read committee at my previous job in Stockton, California, at San Joaquin General Hospital, and decided to become trained as a trainer for Reach Out and Read. And so now I'm a trainer for Reach Out and Read, and I'm going to be the new medical director of Reach Out and Read for the Ventura County, which we're opening up and spreading with the help of First Five.
Well, great. Well, I know we have some funding from First Five. I hope we're able to use it to buy lots and lots of books. This first year is really a planning year, a spread year. Where do you intend to start the Reach Out and Read program, and where are you going to spread it from there?
Well, we're going to start the program at my home base, which is our clinic, Pediatric Diagnostic Center, which is a satellite clinic of Ventura County Medical Center. We'll then try to spread it to the adjacent satellite clinics that are also clinics for Ventura County Medical Center. For example, Mandalay Bay Clinic in Oxnard, and the Sierra Vista Clinic in Simi Valley and Santa Paula West. After that, we will continue to spread it through all of the pediatric and family practice clinics that are affiliated with VCMC, and then continue to include pediatric clinics, private practice clinics, and other clinics who might wish to be involved in Ventura County.
Well, I know there's information online, and we'll make sure that our listeners and viewers have an opportunity to see more about the Reach Out and Read program.
Sure.
But what's it like? Do the children get booked once in their lifetime, or when do they get their books?
No, Reach Out and Read targets children in early childhood. So our mission is to promote early literacy between 6 months to 5 years of age. So the program involves handing a book to a child at each well child visit in the pediatric clinic or family practice clinic between 6 months and 5 years, so that we expect a child, by the time that they've become 5 years old, to have had 10 well child visits and to have received a small library collection of 10 books from Reach Out and Read.
Well, that's great. I know with my daughter, we couldn't get in the car without her having her set of books, and certainly bedtime was made a lot easier with a book. Do you teach the parents how to read to children? It's not the easiest thing in the world. It seems simple.
Right. So Reach Out and Read is actually based on a 3-part model, and one of the parts of the model was the giving of the book itself, so that the child receives a beautiful brand new book at each well child visit, and it's something colorful and beautiful that they get to keep, and it motivates them to read it at home. And as the provider, either the doctor or nurse, hands the book to the child, they're modeling to the parents how to read to the child and really making an impression on the parent about the importance of reading. The other part to the model, though, is to teach the parent age-appropriate tips on how to encourage reading with their children and what to expect cognitively and developmentally from their child, and continued encouragement at each visit to have the parents read on a daily basis to their child. And then the third part of the model is that we will have literacy-rich environments, especially the waiting rooms. We plan to have volunteer readers in our waiting rooms who will be reading gently used books to children in groups, and we will also hope to place gently used books in the waiting rooms for children and siblings to read while they're waiting for their doctor visits.
Are these books available in Spanish?
They're actually nationally, they're available in many different languages. Here we hope to focus in on probably mostly Spanish and English books. We will have a well-stocked shelves with English books, Spanish books, and bilingual books, Spanish and English. But on a national level, they're available in a multitude of languages.
I know in my own practice, I can speak asthma Spanish pretty well, and a lot of our doctors feel like they speak a medical Spanish and can talk about diarrhea all day, which is not the best way to order food at a restaurant. In your experience, have these books really helped the physicians to get extra vocabulary and give just a hand up in terms of their patients wanting to come back to see them?
In some cases it does. It really depends on the provider, but some providers really do spend a lot of time introducing the book to the family to the point where they might read an entire book during the well-child visit to the family, and if that's in Spanish, then they will pick up some of the language themselves. And that's just a way of modeling the intonation that you'd use when you read to a book, turning pages, how you would set a child up depending on their age, prop them up or support their heads, and model to a parent right there in the clinic environment how you would read to a child.
Well, I know we're up to, I think, around 23 immunizations a year. It seems like the children are turning into human pincushions. On the other hand, my hospital beds are empty now that we don't have meningitis and a lot of otitis media spreading to more serious infections. In your experience, has it made the doctor's office visit a little easier? At least I'm getting a book even if I'm getting my shots.
Yeah, well, Reach Out and Read feels that giving a book to a child at each visit is as important as giving the immunizations. We really feel that promoting early literacy has a huge effect on people's lives and on children's success eventually at the school level. And if you're successful in school, you're less likely to have other issues on a social level in the future. It's just as beneficial to the physician as it is to the parent, though. The physicians feel that they get so much out of seeing a child become bright-eyed over a book. They really enjoy that, and almost all physicians who introduce Reach Out and Read in their practices say that it's the best part of doing their physical is giving the book to the child. And you learn to see that children come back asking for more books, and it's a joy to see that. And it's a way of promoting parents to bring their children in for their well-child visits. Children actually want to come in.
I know with the program, we're going to need to look for matching funding. We have some funding from the First Five and some funding from Reach Out and Read.
Right.
And we really look forward to working with Kiwanis clubs, Lions clubs, the Optimists. We need readers as well as funds.
Sure. Right. Whenever we start a Reach Out and Read program, the national program does help you out a little bit with a starter fund. And of course, we have received a grant from First Five, which is going to be a big support to us. But we continually will need to seek out donations from private and public sectors. And that's the basis of Reach Out and Read. And we will be needing to pursue public businesses, communities, wherever we can look for funds. Because it's a totally nonprofit, donation-based organization.
We really look for the people of Ventura County to get moving and get behind this program.
Right, that would be wonderful.
Thank you so much for joining us.
Thank you.